I think we would like to highlight the critical issues that are affecting the government doctors at this moment. The first one, obviously, is the injustice that was given to our new contract medical officers. I'm very heartened by the reply and the tweets by YBMK. I do have to say that YBMK has replied that they will be looking at it. Dr. Lee Boon Chai has also replied last night in Parliament that they are looking at it. However, we would like to say a stronger statement here as well. Looking at it is one thing. We need to be fair to our junior doctors. Two doctors are performing the same task. There should not be a discrimination between a contract medical officer and a permanent officer. We must ensure that we take care of the welfare of our staff. The doctors are an asset to KKM. Every statement that I have come out before via Facebook and social media, government doctors and healthcare staff go above and beyond to give you the best healthcare system in the world. Recognized. We are number 3 in whatever things. But this is all at a cost, because the doctors are working very hard, the nurses are working very hard, sacrificing a lot for the health of the country. But at the same time now we are asking this, treat us fairly. I cannot understand how this would have happened. And this is, to me, a great injustice. Now, we do understand that the country is having a lot of financial difficulties. We are in a very difficult time. And the fact of the matter that we will not be able to have, enjoy permanent positions for everybody. But what we are asking for is not to give permanent positions to everyone at this moment. But we are asking for a fair chance for everyone, that the selection process be fair, be transparent, and be available to everybody to see, and so that they know exactly what they should be doing. When I retire, they will be sitting where I am now as a specialist, because in 10 years' time, these are the young doctors that will become specialists. You will only see the effect of all decisions that we make today in 10 years. We are seeing the decisions made 10 years ago. Okay, and this is where we are now. The contract officers came about in 2016, December 2016. When they suggested the contract house officers, we were having a lot of problems. Pejawatan habis, to use a very simple term. There were no positions for house officers. In order for them to take in the house officers, we needed to start the contract process to enable us to absorb the house officers faster. At that point in time, MMA was there and we had already voiced our concerns. A contract house officer, when they become a contract medical officer, should not be denied or should not be given lesser terms than that of a permanent officer. We should not be discriminating against these junior doctors. Right? And we were assured. However, in a sudden turn of events that we have just found out recently with the first batch of officers finished in 2018 in December. Okay, the first batch of contract house officers finished in December. They took 6 months to decide who would get permanent and who would continue as contract. And when the contracts were offered, it was U41, which came as a shock to all of us as well. This is why we are holding this press conference. Now, what are we going to do in the future? We must also understand that having contract medical officers and permanent medical officers creates a problem for postgraduate training, the opportunity to become a specialist in simple terms. A lot of doctors that are government, that will be contract officers, will not be offered the current government contracts to become specialists. YBMK and DG did mention about the opening of the parallel pathway. We are highlighting that the parallel pathway also takes 4 years to complete. You have given them a 2-year contract. Where are they going to complete another 2 years? It's logical. We need to ensure that the contract must cover the specialty training as well. And after that, we know that we are short of specialists in this country. How many of you have gone to a clinic kesihatan or visited a government hospital? You can see the long waiting times. You can see the wards that are overfilled. We need the positions. JPA and the government has said that there should not be an increase in government positions. YBMK has rightly said the Ministry of Health, the Ministry of Education should be excluded from this. YBMK has said and has asked for 21,000 positions. We were denied and asked to reconsider to 10,000 positions. But be clear, these 10,000 positions are not just doctors. Only 1,000 of that 10,000 are for doctors. The rest are for support staff. Every doctor is not an island. We require support. Our third statement that I would like to say now is also this. We must also be clear that with 4 years of experience, we are worried that these doctors that are trained for 4 years being let out into the private practice, what are their employability? You know, what are the chances of them being employed? A lot of the private hospitals and all that are looking for senior doctors because they want you to function independently. You want experience, right? Okay. The other thing that can happen to them is they have been denied the chance for postgraduate studies. When you go out, you are essentially the only option that you have to maintain in clinical practice is GP practice. And you saw what happened. If you are aware of the news that happened yesterday, GP practice is also having problems. This is not something simple that we can just open the floodgates. Thinking for the health of the country, thinking for the safety of our patients, we need to ensure that in order to achieve universal healthcare, which is what Malaysia, the Ministry of Health wants to achieve as decided by WHO, to achieve universal healthcare, we must ensure our doctors are trained, our nurses are trained, and we have excellent coverage in all aspects of the country.